Ben Dodd from Brisbane Upper GI, just wishing to talk to you about hernia repair surgery. Now, hernias are weak points in the strong muscle layer of the abdominal wall, and these weak points or defects end up having contents from the abdominal cavity pushing through out through the defect to lie in the tissues under the skin. Hernias are really common, particularly in the groin and umbilicus, with up to 1 in 3, and particularly for males, with up to 1 in 3 males having groin hernia surgery in their lifetime. The reasons that we would suggest operating on hernias are if they're particularly symptomatic in a fit young patient. That's not going to go away by itself, so that's where an operation becomes indicated. Or if the hernias are hard to reduce, hard to push back into the abdominal cavity, and particularly if they have bowel contained in that hernia, then that is quite a strong indication for surgery. If hernias strangulate, that means that the tissue within the hernia or protruding through it becomes stuck fast, and then the blood supply to that tissue is compromised, and that then requires an emergency operation. In the context of bowel being strangulated in a hernia like that, that can mean very major surgery, large open incisions, bits of bowel removed, joins between bits of bowel, and then you're talking about much more major surgery. Which brings me to the consideration of having surgery. If you have a hernia that's asymptomatic and you're an old frail patient, then do not have an operation. But if you're a young, fit, functional person, then the natural history is that hernias get bigger over time. And so usually in such young patients with hernias that are symptomatic, we would suggest that you do proceed with having it fixed. And part of this decision or recommendation comes down to the fact that modern hernia surgery is extremely safe. It's almost always done as a day case. It's, for the case of groin hernias, always laparoscopic and keyhole, meaning that patients usually wake up with no pain whatsoever, go home on the day of surgery with Panadol and Nurofen, and rarely do they need anything more than that. The recovery can involve some bruising and stiffness. Certainly with all hernia repairs, I would recommend that patients avoid heavy lifting for at least 6 weeks post-operatively, and as the strength of the repair increases to a maximum at about 6 weeks, usually then patients can resume most normal activities. Having said that, clearly if patients are overweight, or if they do very heavy lifting jobs, or have chronic diseases or tissue weakness from smoking, these factors all increase the risk of the hernia coming back. So it's not perfect, but it's extremely safe. It almost always involves the use of mesh or gauze, and modern versions of this mesh are really lightweight. For the groin hernias, it's approximately 8 by 10 centimeters in size, sometimes a little bit bigger, but basically that gauze is very lightweight and pliable. If you throw it up in the air, it would float to the ground. It's got lots of pores in it, and basically it works by just creating more scar tissue in the area, and that's how it makes the abdominal wall stronger and reduces the hernia recurrence risk right down. And in most young, lean patients who can avoid heavy lifting for 6 weeks, we would expect that the hernia recurrence rate is in the order of 2 to 4%, meaning over 95% should not have a recurrence in the longer term. There, of course, are small risks of bleeding, small anesthetic risks. Using the keyhole approach, though, does minimize the wound complications and means that mesh infection, one of the major complications of the past, should never happen. So modern version hernia surgery, usually almost painless, very safe, and does have very high success rates in the longer term in appropriate patients. Feel free to come and talk to me and ask any more questions you may have about this before we consider whether or not to operate is the right thing for you.